Presumptive communication remains a recommended starting point for most vaccine discussions. By confidently assuming vaccination will occur, providers reflect both clinical norms and public health priorities. This approach has consistently been associated with higher vaccine uptake. However, not every conversation follows a straightforward path. Patients or parents may express ambivalence, which is mixed or conflicting feelings about something. This could sound like, "I know vaccines are important, but I'm worried about side effects." It could also sound like, "I want to protect my baby, but it's just so many shots." Ambivalence is common and understandable, especially in today's climate of confusion, where vaccine information is often misrepresented and mistrust is widespread. In these situations, it's appropriate to pivot from using presumptive language to a more exploratory and collaborative approach using motivational interviewing, or MI. MI is a patient-centered, evidence-based strategy that helps individuals resolve ambivalence, strengthen motivation, and move toward informed, value-aligned decisions. In the context of immunization, MI has been shown to build trust and improve vaccine acceptance, particularly among those who are uncertain or hesitant. It's important to note that ambivalence is a necessary condition for MI to be effective. Let's look at some of the key principles of MI. Open-ended questions encourage patients to share their thoughts. Instead of asking yes or no questions, you could say, "Can you tell me more about your concern?" Affirmation acknowledges efforts towards making a change, and reflective listening helps the patient feel heard. If a parent expresses concerns about vaccines causing autism, a response might be, "I really appreciate how much you're looking out for your child's well-being. From what you've shared, it seems like you're feeling uncertain because of things you've heard about vaccines and autism." These principles validate feelings, demonstrate attentive listening, and foster trust. Before providing information to a patient, ask permission to share information by saying, "Would it be okay if I share what I've learned about this vaccine?" This establishes a collaborative dynamic rather than a confrontational one. Support the autonomy of the patient and reinforce that the decision ultimately rests with them. "It's your decision. I'm here to provide you with information so you can make the choice you feel is best." To gauge how motivated a parent or patient is to get vaccinated, consider using scaling questions. You can start with, on a scale of 0 to 10, with 10 being very important, how important is it for you to receive this vaccine today? If the patient responds with a number between 0 and 3, we recommend limited intervention, as those with very low motivation are often not receptive to discussion, and repeated conversations can increase resistance. Responses between a 4 and 10 allow the provider to explore motivations. Why did you choose 5 instead of 4? What would it take to reach 6 or 7? This encourages reflection and helps patients articulate personal values and concerns. These strategies integrate concepts from a previous video, including presumption, empathy, social norms, and trust building, within a structured framework for guiding vaccine conversations. Let's now see these useful tools in action. In this first video, the patient expresses hesitancy about the influenza vaccine. Notice how the provider begins with a presumptive statement, but then shifts into MI, showing empathy, listening reflectively, and supporting the patient's autonomy.
Good morning, Maeve. It's nice to see you. How have you been?
I'm good. How are you doing?
Good. Thank you for asking. As we head into this flu season, I noticed you have yet to get your flu vaccine. That's something I'd like to get taken care of for you today. Any questions?
Yeah, I guess I'm young and healthy, and I've never had an issue with the flu before, so I just think I'm going to skip that today.
Yeah, I appreciate you sharing that with me, and really not an uncommon way to feel, especially when you've been healthy in the past. Would it be okay if I share a little bit about why I think it would be important for you to get the vaccine today?
Sure.
Okay, so the flu vaccine is designed to kind of protect us against what we anticipate will be the flu viruses circulating this season. And while it's not a perfect vaccine, it does prevent a person's risk of becoming sick with the flu by about 40 to 60%, depending on the season. So even though you're young and healthy, it could help you, have to miss days in school, miss days in work. And it's also designed to help keep you out of the hospital by becoming severely ill as well.
I guess I get that, but I'm still just not too worried about it personally. I've never had run-ins with the flu, and even if I did get sick, it's not like I'd go to the hospital or anything.
Yeah, again, totally understandable to feel like you're at less risk because you're young and healthy. That makes a lot of sense. The thing is, this virus can be quite unpredictable, and some seasons are more severe than others. And we do see people your age, experience more moderate or severe illness. The other thing with the flu vaccine is that you're not only protecting yourself, but actually those around you too. So anyone at the extremes of age or who might be immunocompromised, whatever, you're helping to keep them protected from this virus as well. What stands out to you about what we just talked about?
I guess it's helpful to know that it protects those around me as well. It's not just about me, and that, I could be hospitalized, I guess.
Yeah, something people don't often think about. Well, how about this? On a scale of 1 to 10 today, how ready do you think you would be to receive your flu vaccine?
Probably a 6.
Okay, great, a 6. So why didn't you say a lower number, like a 5?
I guess hearing you bring up members in the community, I think about I'm going to be meeting up with my family soon, and my grandparents will be there, and my new baby niece, and so I would hate to bring something to them and make them get really sick.
Yeah, well, that's a really thoughtful reason. I appreciate that. So again, it would help not only reduce your chance of getting sick, but maybe your loved ones as well. That's nice to hear. What do you think it would take to get you to a higher number, like maybe a 7 or an 8 of accepting the vaccine?
I guess maybe just reassurance that it won't make me get sick.
Yes. Okay. Another common question. Thank you for bringing that up. I always like to reassure patients that the flu vaccine, in fact, cannot give you the flu and does not make you sick. One of the common misconceptions about that is it can induce a lot of side effects that might be similar to a milder version of the flu. Those are usually front-loaded and go away within a day or two, and they'd certainly be a lot less than the actual illness of influenza. The other thing is sometimes it takes our body a little time to mount a response, so it's possible you can pick up a virus, including even influenza, in the 1 to 2 weeks it might take you to get full protection. But you should not get sick from the actual flu vaccine itself.
Okay, that's helpful to know.
Well, good. So given everything we've kind of chatted about, what do you think you'd like to do today?
I think I'll go ahead and get the flu vaccine. Doesn't seem like an extra hassle, I guess.
Excellent. I think you're making a really good choice for your own health and those around you. So I'll have my nurse come in and get that taken care of for you today.
Perfect. Thank you.
Yes, my pleasure.
When the patient shares that she feels low risk, the provider validates her perspective, explains varying levels of risk in relatable terms, and highlights the role of vaccination in protecting others. The provider then uses a scaling question. On a scale of 0 to 10, how important is it for you to get the flu vaccine today? Her answer helps the provider gauge readiness. Following up with why that number and not a lower one encourages the patient to voice her own reasons in favor of vaccination. This technique strengthens internal motivation and ties the decision back to the patient's values. By the end, she reflects on both personal and community benefits and chooses to be vaccinated. In the next scenario, a parent expresses concern regarding the MMR vaccine, specifically regarding an alleged link to autism. The provider utilizes a presumptive approach combined with MI principles, reflective listening, permission to share information, and support for autonomy.
Good morning, Kylie. Good morning, Emma. How are you guys?
Good. How are you?
Good. Doing well. Hard to believe we're doing her 12-month well child checkup today. Given that she is a year now, she's due for a few vaccines. So at this visit, we recommend a vaccine to prevent against chickenpox and things like hepatitis A and pneumococcal, as well as the MMR vaccine.
So we have some questions about the MMR vaccine. I think we're just a little bit worried. We've heard some things that it might cause autism, and so we're just not sure about that vaccine.
Yes. So MMR is a very important vaccine we do. It prevents against for diseases like measles, mumps, and rubella, diseases that we really want to prevent. It sounds like you might have some questions, and that is one that other parents have brought up to me as well. I know there can be conflicting information, out there, and you want to make the best decision. Would it be okay if I shared what I know as a pediatrician about MMR vaccine?
Yeah, I think that would be helpful.
Okay. For starters, this is something that's been studied extensively, and there has been no link found between the MMR vaccine and autism.
So wasn't there a study maybe like some years ago that showed that there might be a link between the two?
Great question. Yes, there was indeed a study in the late 90s by a man named Andrew Wakefield. Unfortunately, he admitted to falsifying some of the data. It was a very small study, involved just a handful of children or more. And since that time, we have, again, done many studies that have been better conducted and well conducted over hundreds of thousands of children, kind of reproving the safety and efficacy of the MMR vaccine. And I can confidently tell you there's been no link between that vaccine and autism.
So I guess it's helpful to maybe understand that we've done a lot of studies and shown that it's not maybe associated with autism, but how would you explain the rising number of autism cases, or just the number of children that have autism? It seems like it continues to go up. Like, could it be from vaccines?
Yeah, really great observation. We, in fact, are seeing rising amounts of that diagnosis. Many experts believe that's largely due to just increased awareness by people and providers, increased diagnostics that we use, and actually the criteria was actually changed to make the diagnosis of autism a few years ago now. So I think we're just kind of catching more people. But again, I do confidently believe it's not due to any vaccine.
Okay.
And I'd be happy to share with you why MMR in particular, I think, is so important.
Yeah, I would
to keep her. Yeah.
Love to hear that.
So as I said, it protects against these 3 different diseases. One top of mind right now for a lot of people is measles. Mm-hmm. Measles is one of the most infectious diseases that we know of. And people like Emma that are really young, or they're really old, or anyone in the community who might be vulnerable for another reason can be at high risk of this. And we've been seeing little pockets of outbreaks in the country due to people not being vaccinated. So I think it would be important to keep her and our community safe today.
Yeah. So if we did the vaccine today, are there any risks we should know about? Any side effects that I should be on the lookout for? Like, just can you walk me through maybe some of the safety?
Sure. As with any vaccine or medication, there can always be a side effect. Usually it's pretty minimal. We anticipate things like redness or soreness at the site of the injection. With this one in particular, you can experience a low fever, sometimes a mild rash. Usually that goes away on its own in a day or two and is not, anything to worry about.
Okay.
Does that address your concern?
Yeah, I think so. I think that makes me feel more comfortable about getting her the vaccine today.
Great. Well, I'm here to support you. Any other further questions or things you'd like to discuss?
No, I think we're ready to do it. That makes me feel confident.
Okay, I think you're making a great choice for her health and your family's health today. So I'll have my nurse come in and get those ready for you.
Great. Thanks,
All
Dr.
right.
Newman.
Bye-bye.
Can you say thank you?
The provider begins by acknowledging the concern and asking permission to provide information. The mother's concerns are addressed directly yet respectfully, citing rigorous studies and explaining the original study's limitations. Empathy and validation remain central throughout. Social norms and the importance of community protection are emphasized, while parental autonomy is reinforced. The parent leaves the discussion feeling informed, listened to, and confident in their decision to vaccinate their child. These examples demonstrate several key principles of vaccine communication. Begin with a presumptive approach, then transition to motivational interviewing when ambivalence arises. MI uses empathy, reflective listening, affirmation, permission to share, and support for autonomy, helping providers address concerns while maintaining trust. Open-ended questions and scaling questions facilitate exploration of patient or parent concerns and motivations. Social norms and clear, balanced communication reinforce trust and vaccine acceptance. Combining these strategies ensures that vaccine discussions are effective, respectful, and patient-centered. Providers who listen attentively, address concerns empathetically, and provide guidance in a supportive manner promote informed, value-aligned decisions. Additionally, using these tools may also help streamline the discussion, reducing the time spent on vaccine conversations and addressing patient concerns.